Assalamu alaikum wa rahmatullahi wa barakatuh. Today we are going to discuss how to approach a case of communication, station 4 in MRCP Paces Exam. Station 4 is 20 minutes, 14 minutes with the surrogate, 1 minute for reflection, and 5 minutes with the examiner to discussion about the case. You are given 5 minutes before going to the station. In these 5 minutes, you are given the paper, including the scenario that you are going to discuss with the patient, and your position, maybe senior officer or or medical registrar. So you have to read the scenario in details, and you have to focus on every word in the scenario. You have to keep the patient name because you are going to identify the patient, and you have to keep your rule in the case. Are you senior house officer or are you medical registrar call? Okay, let us to put on our mind that presentation of a case of communication station 4 in the exam is a matter of acting, tragedy acting. Actually, you have to be a good actor in the exam. Good acting, showing the empathy and sympathy, is very important. Also to know informations about the ethical and legal issues in the case. We are going now to draw skeleton or scheme, which is fixed skeleton or scheme for all the cases of communication station 4. So this is our fixed skeleton that we are going to put in our mind for every case in communication. As we said, you are given 5 minutes. Read the scenario properly. Concentrate in the scenario. What is the scenario given for you? What's the symptoms of the patient? Any investigation done for the patient to what in your mind? And what's your role in the case? What's the name of the patient and your role in the case? Then you have to write before going to the station your approach or your headlines that you are going to follow in the station, not to forget something important. Okay, now this is our skeleton or our scheme, which is fixed for all the cases, but the inclusion will be different from one case to the other. First of all, go to the station when the station starts. Go to inside. You will see the surrogate sitting down. Smile to the surrogate. Shake hands. Identify yourself. Like, I'm Dr. Sadiq, for example, senior house officer of the medical department. Nice to meet you. Confirm the patient identity. I'd like first to confirm that you are Mr. Ahmed or Mrs. Mona, for example, 25 years old. Yes, doctor. Okay. Then confirm agenda of meeting. We are together today to discuss some issues related to your condition, or we are together today to discuss the results of your imaging or your blood test. Is it alright with you? This is confirm agenda of meeting and take permission from the patient. If it is a case of chronic counseling for chronic illness or breaking bad news, which are the most common cases in the exam, ask the surrogate if he wants anyone else to attend this discussion. But in cases like HIV, for example, counseling for HIV, you are not advised. It's absolutely contraindicated, or absolutely don't ask the patient if he wants anyone else to attend the discussion, because there is a matter of confidentiality here. Which has not to be broken. So ask about if you want anyone else to attend the discussion, but in some cases like breaking the confidentiality is contraindicated as counseling for HIV, you don't have to ask him if he wants anyone else to attend the discussion. Ask open question. How much do you know about your condition, please? Can I know how much information or how much do you know about your condition? Ask him about his expectation. Can I know, please, what's your expectation regarding your illness or your symptoms or regarding the results of your blood test or imaging? Then here, this is a yellow area. This yellow area is very important. Here in this yellow area, you are going to break the bad news for the patient. You are going to inform the patient about his illness or his disease. And it has to be within empathic or sympathetic manner, not to deal with the patient like a machine. So you are going now in this yellow area. I name it the tragedy acting area, okay, or the area of uh, breaking the news with tragedy acting, showing the empathy and sympathy for the patient. So now you will start to break the bad news for the patient in gradual manner, not to hurt the patient, not to get the patient to make the patient shocked. You don't have to throw a stone in the face of the patient. You have to make it gradually, okay, graduated in graduated manner and in reasonable manner. So you are going to in this area to tell the patient that the results of the blood test or imaging has done for you has been released today, and it is not as we hope. Stop for a while. It's revealed that you have a disease called multiple sclerosis, epilepsy, hypothyroidism, whatever, cancer. Stop for a while and let the patient to express his thoughts and his feelings at this point. Then tell him, I'm really sorry for this bad news today. You can in this point to wait for a while to know to see the act of the patient or the reflection of the patient or the reflex of the patient. Maybe the patient he didn't ever uh, heard about multiple sclerosis or epilepsy or hypothyroidism. So at that point you have to ask him, uh, do you have any idea about this disease? As we said, this area is very important area in graduation of telling the patient his disease, not to throw a stone in his head. Okay, you have to make it graduated or diplomatic manner to inform the patient about his disease and to show empathy and sympathy in this point or during that time. This is the tragedy acting area, the yellow area. The results of the blood test or imaging has been released and it is not as we hope. It revealed that you have a disease called multiple sclerosis, epilepsy, hypothyroidism, cancer, whatever. Stop for a while and see what the reflex of the patient. Let the patient to express his feelings. And tell the patient, I'm really sorry for these bad information today. If it is cancer, for example, I'm really sorry for that. I know it is hard for you. But be sure that we are here to help you as much as we can. How do you feel now? Such these questions and these empathic and empathic sentences are very important to be said to the surrogate. Then we are going now to the green area. This green area is the area of explanation of the disease. You have to ask the patient, how much do you know about this disease? Do you want me to explain more about this disease for you? Then you will start for explanation of the disease. You have 3 points you have to cover in the explanation of the disease. Start to explain the disease simply avoiding jargons. Jargons means medical terms. You have to avoid medical terms completely. And explain the disease simply for the patient with simple words. Don't push a lot of information for the patient which is not needed. Explain the symptoms and the complications of the disease. Explain the management that you are going to do for the patient. management plan, and of course don't forget the referral because you are only senior house officer, so you are not the one to give treatment for the patient. You are going to refer the patient to a specialized doctor. So explain the management plan, and you are going to refer the patient to a specialized doctor or a multidisciplinary team according to the case to give him the proper care and plan of management. These two areas, the area of tragic acting, of breaking the bad news gradually, and this area of explanation of the disease are very important to reach your to make the idea or your idea to reach the patient simply with empathic and sympathetic way. After explanation of the disease, you have to explore the social history of the patient. Social history is very important for all the patient of communication skills. So it is fixed for all the patient of communication skills social history, and also for the patient of history taking and station 5. So social history is fixed for all the patient communication, station 4, history station 2, and station 5 as well. In history, you have to ask about 4 questions you have to ask about. May I know what do you do for a living, or what's your job, and how much his or her symptoms affect her or his job and usual daily activities. This point is very important to be asked. Why? Because the symptoms of the patient or his disease may affect his job. So at that time you have to refer the patient. I'm sorry for that. I'm going to refer you to occupational health physician to solve any problem for you or to provide you with another job which is more safe in your condition. For example, if he cannot cope with this symptoms during his job, or his job is contraindicating his situation. And also in what's the impact of his symptoms on usual daily activities as well, because at that time if there is problem you have to refer the patient to a social worker to solve any problem, social problem related to his condition as well, with whom the patient is living and who is supporting him or her at home. Very important. Also, maybe the patient is living alone, maybe the patient has his wife also has comorbidities and needs support, so that at that time you will contact social worker or maybe specialist nurse to give him the proper care. Is the patient financially supported? Is the patient smoke? And if he is taking drink alcohol? So these 4 questions are very important to be asked in all the cases of communication skills or history or station 5. Then emphasize again why I'm focusing on emphasizing, because most of the candidates are dealing with the patient like it is a mission, he wants to finish this mission as much as soon as possible. No, it is a matter of acting, and you have to emphasize and synthesize more and more, uh, especially in the cases of counseling for chronic illness or breaking bad news in cancer, for example. Emphasize again for this bad news. I'm really sorry for this bad news. Again, I know it is hard for you, how much it is hard for you, but be sure that we are here to help you and to give you the proper care as much as we can. Then ask about the concern. The concern is very important also. Concern, if you lost the concern, of if you forget to ask about the concern, it means that you lost all the exam. Concern, very important to be asked. You have to ask the patient directly what's your concern after the social history, and after emphasizing after social history, then ask about his concern. Any other concern, because the patient may have many concerns, and you have to reply the concern properly also and in diplomatic way, and to pick up words, because the examiners may catch one word you said for the patient, and this word he may decrease a lot of marks for you because of this word. So you have to be don't talk so much. It is not advised to talk so much for explanation of the concerns, because a lot of talking will make you to fall in false. So just in the replying of the concern is just make it very brief, okay, and very in very simple language and avoiding jargon as well. Then summarize your the discussion of today. I'm going to summarize for you what we discussed today. Check understanding for the patient. In summarization, also you have to do summarization in brief, not to repeat all what you explained for the patient again. No, just summarization of what is the disease, what's your findings, and what's the disease, and what's the management, and what's the symptoms, complication, what's the management plan. The important points has to be summarized only. Check understanding of the patient by asking, can I know please how much did you get from our discussion today? Of course, in dealing with the angry patient, don't check understanding. If the patient is angry in some cases of communication, don't check understanding because the patient is in a good situation to check his understanding. Help. Um, Help is very important at the end of the discussion. The help in the form of, I'm sorry again for this hard, bad news today. I'll give you some leaflets, brochures, websites to know more about your condition. And I'll give you also my contact number to contact me at any time if you have any worries or queries. Anyone to drive you home? This is also empathic question for the patient. If you don't have anyone to drive you home, we can provide you with someone to drive you home if you don't mind. Any other question? Nice to meet you. Shake hands. So let us agree and let us put in our mind this skeleton will be our fixed skeleton for all the cases of station 2. Maybe there is some variable things will be different from one case to the other, but let us to make this scheme or skeleton the fixed one for all our cases of communication skills. Um, okay, there is some ethical issue which are fixed for all the cases of communication skills that the examiner may ask you about. All the cases of communication skills has ethical issues in the form of autonomy. Autonomy means that the patient has the right to know about his condition and to share the management plan. Justice. The patient has the right to be treated without, regardless his race. The patient has the right to be treated regardless his race, color, or his religion. To goodwill for the patient and not to do harm for the patient. All of these four ethics are fixed for all the cases of communication if the examiner asks you. There is other ethical and legal issues may be added in different cases according to the case. We are going now to do presentation for a case as a sample for communication to apply our skeleton today. For example, Mr. Hamid is 45 years old. He has been complaining of polyuria and polydipsia for the last 4 weeks. Urine dipstick done for him revealed that he has glycosuria, and the RBS, serum RBS for him is 13.2 millimole per liter. A diagnosis of diabetes mellitus type 2 has been confirmed. You are senior officer of the outpatient clinic. You are asked to discuss the results and the disease of with Mr. Hamid. Now I'm outside the station. I have 5 minutes. I read the scenario. Well, I knew now the name of the patient, Mr. Hamid. My position is senior house officer of the outpatient clinic. Okay, now I'm going to put the headlines that I'm going to follow in my station inside of the surrogates, not to forget something important. So I write in my white paper, check hands, identify myself, confirm the patient identity, confirm agenda of meeting, and take permission. I'll ask him if anyone else to attend. Ask open question how much he know about his condition. ask about his expectation for the results of the blood test done. Then the yellow area of tragedy acting and the breaking bad news, gradual breaking of the bad news with empathy and sympathy. Then I'll ask him, how do you feel now? Then I'll give him explanation of the disease, what's the disease, diabetes mellitus, and explanation of the disease, symptoms and the complications, and explanation of the management plan and the referral for a multidisciplinary team. Then I'll take social history, including the four questions we talked about. Then I write emphasizing again. I'll ask about the concern. I'll do summary for our discussion, check understanding, and help. Now I wrote the headlines that I'm going to discuss with the patient inside, not to forget something important. Now I'm going to present the case. Good morning, doctor. I'm Dr. Sadiq, the senior officer of the outpatient clinic today. Nice to meet you. Nice to meet you, doctor. I identified myself, confirmed the patient identity. I'd like to confirm that you are Mr. Hamid, 45 years old, complaining of increased frequency of your water work and increased thirsty for the last 2 weeks. Yes, doctor. Mr. Confirm agenda of meeting. Mr. Hamid, we are together today to discuss the results of your blood test. Is it alright for you? Yes, doctor. Ask about anyone to attend the discussion. Do you want anyone else to attend our discussion, Mr. Hamid, to support you? No, doctor. Okay. Open question. Mr. Hamid, I'd like to ask, how much do you know about your condition?